Good afternoon, everybody. Thank you once again to all of you for joining us for this daily update on COVID-19. I'm very pleased to be joined today by Dr. John Mitchell. John is a consultant psychiatrist and also a senior advisor to the Scottish Government. Given the nature of this crisis, much of our focus is on protecting physical health, and rightly so. But we also know the anxiety that is caused by this virus and also the stress and the isolation of the lockdown measures themselves can have a really big impact on mental well-being. So for that reason, today's briefing will have a special focus on how we support our mental health through this crisis, and John will be able to offer some important information that hopefully will help you do that. Before that, though, I want, as usual, to provide you with an update on some of the key statistics in relation to COVID-19 in Scotland. As at 9 o'clock this morning, I can advise you that there have been 6,358 positive cases confirmed. That is an increase of 291 from the figures reported yesterday. Across Scotland, a total of 1,798 patients are in hospital with confirmed or suspected COVID-19, and that is an increase of 1 since yesterday. A total of 196 people as of last night were in intensive care with either confirmed or suspected COVID-19. That is a decrease of 15 on the figures we reported yesterday. And while that is, of course, a positive indication, I would again, at this stage, caution against reading too much into that. Not least because it is with sadness that I have to report today a further 40 deaths that have been registered of patients who had tested positive for the virus. That takes the total number of registered deaths in Scotland now to 615. As I mentioned yesterday, it is likely that registration numbers will have been relatively low in recent days as a result of the Easter holiday weekend, and that should be taken into account, of course, when considering today's figures. I should also remind you that these daily figures are of people who died after testing positive for the virus. And tomorrow, for the second week in a row, National Records of Scotland will publish figures that show the number of people who have died with presumed or suspected COVID, as well as those who have died after having COVID confirmed in a test. Tomorrow's figures will also give the location of death for those who have died, so we'll report on numbers who have died in care homes. Care homes are a cause of concern for us in this virus, and I know they are a cause of concern to people across Scotland, and particularly, obviously, to all those who have a loved one in a care home. We know, and we have always known this, that older people are more at risk of becoming seriously ill or dying from this virus. And we also know from our own experience and from the emerging evidence from other countries that care homes can be places that are more susceptible to outbreaks of COVID-19. So I want to stress again today how hard we are working and will continue to work, not least through the Care Inspectorate, to ensure that care home providers are following the appropriate guidance, that they have good infection control measures in place, and also that they have the support and equipment that they need. And that work will be ongoing and will continue right throughout this pandemic to be an issue of intense focus for us. And of course, the fact is that every death, no matter where someone dies, in a care home, in a hospital or in their own home, no matter the age, the underlying health conditions or the background of the person, every single death is a tragedy that we mourn and deeply regret. And yet again today, I want to extend my deepest condolences to all those who have lost loved ones to this virus. And yet again today, I want to take, as I do every day, the opportunity to thank everyone working in our health and care sector. Your efforts are hugely appreciated, not just by me and by the Scottish Government, but they are appreciated by everyone across the country. Now, as I have mentioned, the main focus today is mental health. But before I come on to that, I want to address one issue which I know is causing some concern, and indeed an issue that is causing concern to the Scottish Government. We are aware of reports yesterday and this morning that supplies of personal protective equipment to care homes in Scotland are being diverted to England. Now, I should stress we're not aware so far that this is an issue affecting supplies to our national stockpile in Scotland, although we continue to monitor that very closely indeed. However, I also want to be clear that if care homes' usual supplies are affected in this way, then as well as that being completely unacceptable in itself, it will, of course, increase pressure on our national stockpile, and that would be a source of real worry for us. So it's not an exaggeration to say that we are extremely concerned about these reports and are taking steps to investigate them further and to seek to resolve them if they are real issues as a matter of urgency. Our Health Secretary is raising this matter with Matt Hancock, the UK Secretary of State for Health, today, and is seeking to speak to him directly about it. And I want to be clear about my view, and I hope nobody thinks this is in any way a point of a political nature. It is a point about fairness and cooperation as all of us deal with the challenge of this virus. All parts of the UK right now are facing supply challenges on PPE. Indeed, this is a global issue. So any situation where supplies were being diverted from one part of the UK to another without consultation or any sense of cooperation would clearly be unconscionable and unacceptable. So that is why we are seeking to investigate these issues further and seeking to address them if they are arising as quickly as possible. My main focus today, however, is on mental health. COVID-19 restrictions have, as I've spoken about every day I've stood here and as everybody is experiencing, these restrictions are affecting all of our lives. People who may never before have been affected by mental health issues may now be experiencing emotional distress. That could be due to financial hardship, bereavement, and the isolation that comes with social distancing. We know that NHS 24 has experienced an increase in calls in recent weeks, including to Breathing Space, which is our mental health phone line, and we would expect to see that demand continue to rise. So we want to make sure that anyone who requires support for their mental health is able to access and receive that support. A few weeks ago, I announced £3.8 million of additional investment to increase capacity in our telephone and digital mental health services. Today, I'm announcing an additional £1 million of investment in mental health services. This will allow us over the coming weeks to expand the use of what is called a distress brief intervention, or DBI. The DBI programme gives people over the age of 16 who are in emotional distress the opportunity to speak directly to trained staff. They will be referred by frontline staff, such as those working in NHS 24. And crucially, the service allows people to talk to the same person several times within a period of a few days or weeks. And for some people, we know that that ability to establish a rapport with the person helping them can make a big difference. The DBI programme has already been operating since 2017 in 4 pilot areas where it has already helped more than 6,000 people. So we're now expanding it across Scotland, and we hope it will be a valuable additional source of help at a time when we know people are more likely to need it. In addition, we will launch a new mental health marketing campaign later this month. The campaign will provide some practical advice on things we can all do to feel better and to cope until these restrictions are lifted. And it will direct people to sources of extra support, to NHS Inform as a key information resource, and to the helplines operated by NHS 24, Breathing Space, the Samaritans, and the Scottish Association for Mental Health. Fundamentally, we all know how hard these restrictions are for people. And we know that this pandemic will have an impact on people's mental health alongside the risk it poses to our physical health. So we are determined to make sure that support is available for you if you need it. As part of this, we are also determined to work to support Scotland's children and young people. Asking schools to close a few weeks ago was, without any doubt, one of the most difficult decisions I've had to take as First Minister, because I knew then and know now just how disruptive this is to the lives of children and young people. But that has been made much easier thanks to the cooperation of our young people, and I want to thank all of you who might be watching this today. Every single day I hear or see evidence about how you're supporting your families and each other, but I know that this situation is still extremely tough for you, and it really is okay sometimes not to feel okay. The Scottish Government has been working with others for some time to tackle mental health issues affecting young people, such as online bullying and body image. But as you're spending more time online right now, it's more important than ever to ensure the online world doesn't impact on your mental health. So later this week, we will launch a new digital resource to help children and young people learn about the healthy use of screens and social media. The Scottish Youth Parliament and Children's Parliament, together with more than 650 children and young people across the country, have been working on this new Mind Your Time resource, which will support mental and physical health online. These resources are due to launch the campaign with these resources on Friday, and I hope this will be valuable at what we know is a really tough and challenging time. And for all of us, I've said before that one of the cruel things about COVID-19 is that we need each other more than ever right now, yet we're being told, for good reason, to stay apart. And that's one reason why I'm so keen to stress the importance of kindness, solidarity and love throughout this crisis. And there is a role for all of us to play in trying to support each other. But I also know that many people will need more specialised help and advice to support their mental health and well-being. And so in many ways, the most important message I want to get across today is this one. Help is there if you need it. The NHS Inform website can help you see what service will be best for you. So please reach out for help because it is there. I'm going to hand over to John in a moment. Before I do that, I just want to end by emphasising once again the importance of following the public health rules and staying at home. Other than for a very few specific reasons, such as exercise or buying essential goods, you should stay at home. You shouldn't be going out. You should stay 2 metres apart from other people when you do go out for essential purposes. You should not meet up with people from other households. And if you or other people in your household show signs of COVID-19, you should be completely isolating, not going out at all. I know how difficult these rules are, and they are likely to be in place for a bit longer yet. But they are essential. They are essential to help us slow down this virus, to protect the NHS and ultimately to save lives. So thank you once again for sticking to these rules, particularly over the most recent weekend when normally you would have been out enjoying yourselves. But you are doing the right thing. I'm deeply grateful to each and every one of you for that, and you are helping us in the fight against this virus. I'll now hand over to John, who's going to say a bit more about the importance of mental health and the support that is available. John.
Thank you, First Minister. It might feel like life is on hold. You might be anxious and frustrated, worried about yourself and about others in your life. It's normal to feel like this. These are unprecedented times. Your family, friends and everyone else you know is feeling exactly the same way. We're surrounded by loss of things we may have taken for granted, like going to restaurants or on holiday, but some might have the loss of their livelihood, some unfortunately will have the loss of their health, and for some, bereavement. It is tough, and it will be tough for some time, but we are all together in sharing this experience, and we share it with people not just across Scotland, but across the world. It connects us with others like we've never known before. So it's never been more important than now that we take the time to think about our own mental health and the mental health of those around us. We all know that we can't really enjoy life without feeling well in ourselves. When we've got good mental health, we're better able to cope and meet the challenges in all other parts of our lives. So what does good mental health mean? How do we ensure that we do the right things to look after ourselves over the coming weeks and months? We've all got used to automatically thinking about staying at home, keeping our distance from others and washing our hands. And as well as those physical habits, I'd like to invite you to think about how we should automatically think about new mental health habits that we need in relation to ourselves and others. And it's really about simple things. We're all social creatures. We have an inbuilt desire to reach out to each other and to help those around us. And there have been so many incredible examples of this already across Scotland. So please phone your family and friends, call them on FaceTime or Zoom, take the time to reach out and let them know you're thinking of them. Ask if they're doing okay. We can also take steps to structure our day, create a routine by ensuring you're getting a good night's sleep, Try to wake up at a similar time each morning. Set yourself goals and stay physically active within the current guidance. If you're feeling stressed or anxious, be careful of how exposed you are to the media coverage and graphic news stories. Although it's important to stay informed, consider taking a break from the news if you feel things are getting on top of you. But it's also important to take time to reflect and focus on the positives in our lives and to think about what we can control rather than what we can't. I very much like this quote from Viktor Frankl, who was an Austrian psychotherapist and psychiatrist. He said, "When we're no longer able to change a situation, we are challenged to change ourselves." I know that we will all come through this stronger, more connected to each other, and better equipped to take care of our mental health. And good mental health, which is a fundamental part of our whole health, can start with a very simple conversation. There's never been a better time to think and talk about how you're feeling. Advice and support is available to help each and every one of you with keeping all of us mentally healthy. As the First Minister said, NHS Inforum is really a treasure trove of very good advice on well-being, on depression, on anxiety, money worries, stress, traumatic events, and I'd urge you to look at it. NHS 24 is there to provide us with telephonic help and their bespoke mental health line, Breathing Space. And for young people, Childline's website and phone line again provides really great examples of things that are important to children and can help them. Young Scot have got super videos for adolescents, and for the elderly, Age Scotland has a marvellous website and phone line. It's also important that the most vulnerable people are helped too, and the Scottish Commission for Learning Disability and Scottish Autism have thought about this carefully and have good guidance. People are amazingly resilient. The current fear, isolation and distress will pass and will not inevitably create mental illness in everyone. But we still have to look after ourselves and each other. For those with mental ill health and those who do develop it, you can still get the help and treatment you need through the existing routes of NHS 24 and mainstream NHS services. Our NHS is here for you.
Thank you very much indeed, John, and I hope you found that helpful. I'm going to hand over briefly to the Health Secretary before we move on to take questions from journalists.
Thank you. First Minister, let me first of all underline the seriousness with which I am taking the reports of personal protective equipment destined for Scottish care homes being diverted to England. As the First Minister has said, we are urgently seeking clarity around this situation. I had intended to raise that personally with the UK Health Secretary today, but he has cancelled the planned call, so I have instead written to him to remind him that he specifically does not have my agreement to the centralisation of ordering or distribution of PPE or to the diversion of orders placed in Scotland for destination to Scottish social care or the health service. However, the main theme we are discussing today is mental health, and beyond the help and the support that you've just heard about from the First Minister and Dr. Mitchell, I wanted to take the opportunity to address directly our health and social care workforce. As the Health Secretary, I am acutely aware of the enormous demands that have been placed on you over the last few weeks. We are asking many of you to work in unfamiliar settings, to learn new skills, to work in new roles. Many of you will be personally affected by the COVID-19 virus. And on top of that, as well as having to cope with the stresses of your job, some of you will be caring for your own families, helping to manage them through the unfamiliar situation in which we all find ourselves. You deserve all of the help and the care that we can offer, and that includes support for your mental well-being as well as for your physical safety. So we're working closely with our partners to provide specialist workforce support and guidance, such as the Psychological First Aid Service, which is available through NHS Education for Scotland. And in the coming weeks, we will announce more of that national and local provision that we're putting in place, covering counselling, trauma services and support in situations of difficulty and anxiety. But of course, the public health mental support services that have been described this morning are open to you as well as to the wider public. So I want to say to our health and social care workforce this: you devote your lives to caring for others. You deserve to be looked after if and when you need it. These excellent services are there for people like you and like me. So if you need help, it's there for you. And I want to finish by thanking you once again for all that you are doing to help us meet the particular challenges of this pandemic, and for the care and the compassion that you are showing every single day in the work that you deliver for our National Health Service and our social care sector.
Thank you very much indeed, Jean. I'll move to questions now. We have more than 20 journalists who want to ask questions today. We will get through them all, no matter how long it takes. But if I could appeal for brevity to avoid duplication, and we'll try to be as brief as possible in our answers as well. But can I go firstly to Fiona Walker from BBC Reporting Scotland?
Of times PPE to care homes. Now, we have been told by suppliers that they've been specifically told that they can provide care homes in England, but not to those in Scotland. Now, does this feel like there's a fight between the nations and that Scotland is coming off as second class? And have Scottish care workers actually suffered as a result of this?
Well, thank you, Fiona. As I said in my introductory remarks, and as the Cabinet Secretary reiterated, we've certainly not given any agreement or authorisation to that centralised procurement of PPE, because we don't think that would work best for us. We're trying to decentralise the distribution of our PPE as much as possible to get it as close as we can to the front line where it's needed. We are looking into these issues urgently and thoroughly. The Cabinet Secretaries had a further discussion this morning with Scottish Care to understand a little bit more about the issues they are facing. We don't yet have any evidence that this is something that is being directed by NHS England, although we want assurances from the government on that. I want to be very clear that, and I hope people have seen from us over the past few weeks, and indeed from the other governments across the UK, how much we are trying to cooperate and support each other through what is a very, very difficult situation, taking our own decisions where that is required, but nevertheless having that spirit of collaboration and cooperation. And I think that's the principle that we must continue to abide by. If we get into competition with each other, then I don't think that is in anybody's interest. And certainly if there is any sense that supplies are being diverted from Scotland or any other part of the UK automatically without any discussion about whether that is part of a cooperative approach, then that would be deeply worrying. So we take this issue really seriously. Everybody is facing real constraints on supplies. It's a daily worry for all of us in government. It's a daily worry for everybody on the front line. We are working incredibly hard to maintain supply, to make our distribution lines as efficient as possible. We've been candid about challenges and issues we've had about that in recent weeks, and to make sure the front line have what they need. So anything like this that risks that stockpile and risks us suffering more of a constraint than we would otherwise is something that we would find unacceptable. So we will continue to try to resolve these issues through discussion and obviously keep people updated as appropriate. James Matthews from Sky.
Hello, can you hear me, First Minister?
Yep.
The story which appeared in the Times appears to be that a private company has a contract with Public Health England, and they have said that we're not contracted to supply to Scotland. Can you give me an example of a Scottish company that has a contract with the Scottish Government that's making its kit available to England?
I can't give you any more detail right now than I currently have. We have heard reports. We've obviously seen reports in the media. We are following up and trying to get a deeper understanding from the care sector, and we will take forward our sort of action on this to try to resolve this on the basis of the information we have. I want to be very clear, I suppose, in two ways today. I am not interested in stirring up an issue that is not a real issue, because I'm not interested in petty arguments at this stage. We all want to do the right thing in equipping our frontline staff with the equipment they need. But the other side of that is I'm not prepared that the Scottish Government will stand by and be treated unfairly when it comes to the fair distribution of supplies. So we are taking these issues seriously. I hope we will find that they are not as serious as we might be being led to believe, but whatever the extent of these issues, I hope we will be able to resolve them quickly and amicably. I come back to the central point. Everybody, not just the countries across the UK, but countries across the world are struggling with global supply constraints right now. It is a worry for all of us, but that really makes it all the more important that we try to cooperate and collaborate, not undercut each other. So we will give further updates on this as and when we consider it appropriate. Peter McMahon, ITV Border.
Good afternoon, First Minister. First Minister, can I take you back to PPE? We've all heard you on many occasions saying that there are now adequate supplies and that you've sorted out the distribution on PPE. ITV Board has been speaking to the deputy care home manager of a care home in Lockerbie. He says it's still difficult to get PPE. He says companies are putting up their prices or running low on stock and they're relying on local donations. Is that good enough?
What you've actually heard me say, Peter, and I'll say it again today, and I'll be really candid about this, this is an area of ongoing challenge. So you've heard me say that stocks, as is the case now, are in good supply, but you've also heard me say we are not complacent about that. You know, we are using PPE at a much faster rate than would be the case in normal times, so we can never be complacent about supply, which is why this issue that we are talking about today is such a concern for us, because anything that further makes our supplies difficult to secure is obviously exacerbating an already difficult situation. You've also heard me say that we've taken steps, and the Health Secretary can go into this in a bit more detail, to streamline and simplify our distribution lines, because, to be candid, at the outset of this epidemic, I don't think we did that well enough. I think our distribution lines were still too cumbersome and taking too long to get to people. So we've proactively supplied GP practices, for example. We've got a triage system in place now. We've got a hub system. We are increasingly trying to get supplies when they're coming from the national stockpile direct to care homes. But you've also heard me say that we will never stand here and say that there will never be challenges and issues around this. That's why we set up the email address for anybody who's got issues to email directly, so that we can quickly get on top of these issues. What I can say absolutely categorically is that this issue on a daily basis, literally on an hour-by-hour basis, has our complete focus and attention, because we know how important it is to get PPE supplies to the front line quickly and in adequate quantities, which is why when issues like this one do arise, we take these forward seriously and try to resolve the issues as quickly as we can, and we will continue to do that. Do you want to add anything about some of the changes we have made?
Thanks, thanks, First Minister. So, as the First Minister has said, we have changed the ordering routes and the distribution routes so that we are covering directly both our acute setting, our hospital setting, our primary care and social care, which includes care at home. There may be more that we can do to improve those routes, and that's one of the reasons why it's always part of the discussion that I have weekly, in this week, twice weekly, with Donald McCaskill from Scottish Care, with COSLA, with the BMA, with the RCN, and later on this afternoon with one of the other main unions operating in this area, so that we are constantly being updated as to where there are glitches or problems in distribution, that we can take action to remove those and make the distribution even smoother. The key objective of all of this is to get the right PPE directly to those who need it, so that they can undertake their job safely for themselves, but also for the clients that they're working with or the patients that they're treating. Now, the other side of the work is supply, and supply is a constant monitoring exercise, iteratively, day after day after day, which is also, as the First Minister has said, why we are taking these current reports that we are investigating and pursuing very seriously indeed, because supply is constantly a challenge, and we need to ensure that those orders that are placed from Scotland are delivered to Scotland, as well as the cooperative work that we undertake at a UK level.
It's just worth reiterating that care homes will have their own suppliers that supply them directly, and it's around that we've heard some of these concerns about some supplies potentially being diverted elsewhere. And secondly, care homes have the ability to get supply from the National Services Scotland central stockpile. Now, if the first of those routes comes under pressure because stocks are being diverted, obviously the pressure on the national stockpile, which of course goes to care homes where necessary and also to the NHS, comes under more pressure. So we need to be addressing any and all of these issues as they arise, and we will continue to do so with an absolutely iron focus on it, such is its importance. Kieran Jenkins from Channel 4.
Minister, it's acknowledged there'd be more certainty about the number of deaths in the community if there'd been more testing. The decision not to test widely was taken before a single death had been confirmed in Scotland. Do you stand by that decision, and will you publish the scientific evidence behind it?
I have taken decisions and will continue to take decisions on the basis of the evidence and the advice I have, applying the judgment and interrogation that people would expect me to, and that's how I will continue to operate. And you know, SAGE I think does publish some of the papers. I've established our own advisory group, and will be very open and transparent about the advice that we base decisions on going forward. In terms of reporting of deaths, we report deaths on a daily basis that are, as I said in my initial remarks, and I've said on a number of occasions over the past number of weeks, based on the people who have tested positive. Now, these will in the main be people who die in hospital, but if they have tested positive somewhere else, they will be included in these figures. We are also now publishing deaths where COVID-19 is suspected or presumed. That first publication was last week, and the next publication will be tomorrow, and that will give us a much more comprehensive picture of the position in the community. And we will continue to seek to put as much information about deaths, about cases, about the trends that we are seeing around this into the public domain to inform the public, but also to be very clear about the basis as we go forward now in terms of the decisions that we are taking. Ross Govins, STV.
Yes, First Minister. Several European countries have begun setting out plans on how they can begin to at least ease some of their lockdown measures. When will the public hear what our plan is?
We are already discussing the various different factors we have to take account. As I've candidly said, we do not yet have enough evidence to take firm decisions around that, but that work of looking at the different options and what evidence we would need to inform those decisions is already underway. SAGE, the UK-wide scientific advisory group, is having further discussions this week. The advisory group that I've established in Scotland, the CMO advisory group, is also having discussions this week, which will help to inform those decisions in Scotland. And of course, there is planned to be a COBRA meeting later this week as well. So I think it's important to be clear on two things. Firstly, it is not the case that these measures are likely to be lifted imminently, because we couldn't do that with confidence and not risk a resurgence of the virus. But as and when we have the ability to see how we do this and in what order and over what timescale, we will be candid and transparent and open with people, both about what we are advising and the basis of that. As I've said before, we will continue to have a need to suppress this virus, and if we are suppressing it now through the lockdown measures, as and when we start to lift them, we will still require to suppress it, and that is where what is called the test, trace and isolate strategy comes back to the fore, and that will be an important part of our consideration. So we are all working hard to get these decisions right, to do them in the right sequence and in the right time frame, driven by that objective of trying to keep the number of people who die from this virus as low as possible. I've got David Henderson next from BBC Radio Scotland.
Thank you, First Minister. With hospital admissions flattening and intensive care admissions falling for people with coronavirus, there are some positive signs in today's figures. Do they suggest to you and your team that Scotland has reached its peak or is close to its peak for this virus? If it does, what happens next? If it doesn't, on what basis, what benchmarks are you using to tell you when we are at the peak of this virus?
In the interest of brevity, which I asked journalists for, I'll refer you back to the answer I've just given to Ross Govans, partly in terms of some of the consideration that is underway right now to inform what is being called an exit strategy. On the sort of main part of your question, I said this yesterday, I'll repeat it again today. The figures we're reporting on a daily basis right now around hospitalisations and intensive care patients are, and I don't want to overstate this before everybody rushes to read too much into it, but of course they are encouraging, because we are not seeing at this stage a rapid rise in the numbers in hospital and a rapid rise in the numbers of intensive care. But what I am advised is that it is too early to be definitive about that, meaning that we've reached a plateau or a peak in any sense, and we need more data over a longer period of time to be certain about that, or to be as certain about that as it is possible to be. If you cast your mind back to the point at which we introduced these lockdown measures, and even before that, when we closed schools, we were always very clear that it would be a period of weeks, 2, 3, perhaps 4 weeks before we would have the data that would allow us to really understand and be confident about the impact of these measures. So I know and understand and actually share the frustration to get to a point where we can say, okay, from this date, here is what is happening and how we will come out of where we are now. But it would be a mistake to do that prematurely, because we would risk jeopardising the gains of the hard work that people have been doing. So I would ask people to bear with us on this, and as soon as we get that data to give us a better basis to make these decisions, we will make these decisions and be clear with people what direction that is taking us in. Fraser Knight from Global.
Thank you, First Minister. Today, the University of Strathclyde has found that 82% of workers who are still going to work in call centres don't think that they're essential workers, but they're still being told to come in where they are hot desking, where they are sharing handsets. Some staff say they're afraid to go to the toilet. I was just wondering, First Minister, would you class call centre workers as key essential workers? And do you think that this issue should have been resolved a while ago, where people are potentially still not following these social distancing and lockdown measures that you've put in place?
Well, we try to have discussions and provide help and assistance to businesses as far as we can. The question about whether a particular business was an essential part of the economy or not would depend very much on what it was doing and what service it was providing. But we've put out, if I go back to the explanation I've tried to give before to make people understand, there's a category of businesses that are categorically being told to close. So pubs, non-essential shops, restaurants, cinemas, that kind of category. At the other end of the spectrum, there's a category of businesses that we know are essential to keeping the country going. So the businesses that keep the lights on and get food moving across the country. In the middle, there's a huge number of businesses where we've tried to give principles for companies to be guided by, because we can't have a bespoke answer for every single company. And those principles have been deliberately precautionary. So we've said to businesses, if you're not essential to the well-being of the country or the fight against COVID, if you can't allow your staff to work at home, and if you can't ensure really safe social distancing, you should be closed. And that is very firm advice that I would give again today. Now, you know, the Scottish Government has taken, I think, a tougher line on that. Construction would be an illustrative example than some other of the governments across the UK, but we've done that very much on the precautionary principle, and that is the principle we would still say to businesses that they should be following. And where there are specific examples where workers think that businesses are not following that, we're always happy to try to give further advice on a more tailored basis. Anas Hassan from Kingdom FM.
Thank you, First Minister, and I'm grateful for the opportunity, and I hope you can hear me. I've been hearing from the Managing Director of a Scottish retail firm which has multiple branches, including in Kirkcaldy, who says to me the business stands to get £150,000 less in support cash during the pandemic because money is given per business north of the border as opposed to per premises like in England. Will you change the Scottish Government's policy to make sure money is given per premises so that firms don't lose out?
I covered this issue a little bit yesterday, but I'm happy to do so again. Yes, we are continuing to look at all these issues. Cabinet met this morning, and Kate Forbes, the Finance Secretary, was giving us an update and telling us about the groups of business that perhaps are not getting any help at all right now, or businesses that feel they should be getting more help, how we could look to deliver more help. But I want to, so there will be further announcements and further initiatives and interventions to come from the Scottish Government around that. We are determined to do as much as we can to help businesses, because this is a situation that is unprecedented for business and the economy. It's a health crisis, but also an economic crisis, and we want to do everything we can. But let me just give an assurance that every single penny of the consequential funding that has come to Scotland from Treasury decisions will go for business support, will go to business support. And we have taken some different decisions around the margins of that in order to help more businesses overall. So there are some businesses in Scotland at a lower rateable value that get help in the form of grants in Scotland that wouldn't get that help if they were in other parts of the UK. We are also giving funding packages to the bus industry, to the seafood sector. We've given companies help with water rates. These are all sources of help that are not available elsewhere in the UK. So we've tried to make sure we take that funding and maximise the number of businesses that are getting support. But we are always open to doing more if we can do more, and we'll continue to look very carefully at what those options are. Alan Smith from Bauer.
Hi, good afternoon. Just a question again about PPE, in particular for care home staff who say they're pleased that they're starting to see more supplies of PPE, but they're concerned about the quality of some of the equipment they're getting. Thin plastic aprons and masks, which many staff have told us are pretty flimsy. So I was wondering what reassurances you can provide to those staff about the quality of the equipment and the level of protection it provides them.
Well, I'll hand over to the Health Secretary, who actually covered this yesterday as well, I think, with the various processes and systems we have in place to assure the quality of the equipment that's been given to staff.
When the equipment is coming from our national stockpile, then that is equipment that is already assured to be meeting the various standards that are in place in order to determine that for example, the masks are genuinely fluid resistant, if that is the case, or that the aprons are of the quality that are needed. So we can be sure that the PPE that comes from our national stockpile through national procurement in Scotland meets those recognised standards. It may be that in other parts, people are acquiring PPE from other sources. I can't comment on whether or not those meet the standards that are required, but what I can give is an assurance that where the PPE comes from our national stockpile, then it meets those recognised standards.
Okay, thank you. Tom Eden from Press Association.
Good afternoon, First Minister. I just want to ask about mental health and children and young people. You said, well, you set out quite clearly all the ranges of factors that could be impacting their mental health. And you said that the help is there when you need it. But for thousands of children in the past, that's not been the case. The latest figures show that more than a third had to wait over 18 weeks. And the average wait time was 12 weeks for CAMHS services. I was just wondering how these services are coping during the coronavirus crisis and what's going to be done when we get out of it to improve services for children.
I'll hand over to John in a second to say a bit more about that. But obviously before this crisis, we were investing heavily in improving access to CAMHS, child and adolescent mental health services, to try to reduce the waiting times. Many more professionals were being employed in that. We had recognised that was a big challenge and remains a big challenge. Obviously, some of those services will require to be provided differently during this period of crisis, but we want to nevertheless send that clear message about help being available if people need it, and encourage people to come forward. And obviously, as with the health service generally, as we come out of this crisis, making sure that we are supporting services in that recovery phase and getting back to normal will be a big priority. John, do you want to say a bit more about child and adolescent?
Yes, this is a good question. Before coronavirus, we were very clear we wanted to do more for children and young people, and we understood that that was both about improving their mental health and well-being at a population level, not just about treating mental illness and mental ill health. Coronavirus has come, and we are in very close conversation with all of the health boards in Scotland so that we're able to help them in how they are having to rapidly adjust their services to be able to prioritise people that need help to get it quickly, and also to ensure that their existing caseloads are being safely and effectively managed. We've also been in discussion with them about children who are on waiting lists, and how we can reach out and give information to them and their families to try to help them. As I was saying today, there is very good advice now available online, the Parents Club, through Young Scots, through Childline. But we do need to think about the well-being of children, and we need to think beyond coronavirus, I think more broadly, as we were doing before coronavirus, about the whole spectrum of needs, about trying to improve the mental well-being of children, not just about treating their mental illness.
Thanks, John. Simon Johnson from the Telegraph.
Hi, Health Secretary. I've just got a few questions about your cancelled meeting with your cancelled chat with Matt Hancock. Can I ask when it was set up? At what point, if any, did you indicate that you wanted to discuss these claims about PPE supplies being diverted to England? And what reason was given for its cancellation?
So we have regular telephone-based, Zoom-based calls, and last week in one of those, which was wider than just the 4 health secretaries across the UK, we agreed in that meeting to have this week, today, another call between the 4 health secretaries to discuss particular issues, but included in that was PPE. That was obviously before the particular reports that we are now dealing with, but it was generally, as we have done before, discuss the wider challenges that we're all facing in that globally challenged marketplace the First Minister mentioned. Mr Hancock advised my office this morning that he was no longer available to have that call this afternoon. So, as I said, I have now written to him raising those specific concerns around the most recent reports and asking for his clarity and assurance on a number of matters. And of course, as we resolve these matters, as I sincerely hope we will, then I will keep you updated on that.
Scott McNabb from the Scotsman.
Hello, First Minister. I realise you want to guard against complacency on the figures, but all the lead indicators we've seen seem to indicate that Scotland is sort of proportionately per head of population about half the rate of the wider UK or English figure. Now, I know that's previously been put down to potential time lag, but I'm just wondering if now, 3 weeks in, we can say that we have contained the virus more successfully in Scotland so far.
I wouldn't feel that I had enough evidence to give me confidence to stand here and say that definitively, much as I would very much like to be in a position to do. As I've said earlier on, some of these indicators are more positive than a couple of weeks ago I might have expected them to be, but you know, we have to allow more time to elapse to know whether that is a sustained position or perhaps a blip in the overall pathway of the virus. We would expect to see numbers of deaths, unfortunately, be the last thing to start to tail off because of the journey of the virus, of people getting infected, getting ill, getting hospitalised, ICU, and then, unfortunately, if they die, dying. So yes, there are there are some signs for cautious optimism here, but I really don't want to read too much into that or get ahead of ourselves in trying to overclaim it. What I would say is that we, at the point lockdown was introduced, Scotland was at an earlier stage of this infection curve, and therefore so we didn't wait until we were at a similar stage. We went into these lockdown measures at the same time, although that for us was earlier, and we have always hoped that would have an impact. And certainly we see levels of death, although every single death is a tragedy. We see death numbers in a UK context lower in Scotland than in some other parts. But look, we are in early days, unfortunately, of this pandemic, and while trust me, I am as keen to look for good news as anybody is. I also want to be clear that it would be wrong to jump on things too early to give people a false impression, because the important thing right now, if we are to keep these indicators going in the right direction, is everybody understands the importance of sticking with the measures that are in place. Tom Peterkin from the P&J.
Good afternoon, First Minister. Your National Clinical Director, Jason Leach, said that claims that PPE firms were prioritising England had been looked into and were rubbish. You're now raising it with Matt Hancock and are investigating it. I'm just wondering, was Professor Leach wrong to dismiss these claims? And secondly, I'm just wondering, what precise discussions have you had with firms like Gomballs that make this kit so far?
On the comments Jason made on radio this morning, I've not heard them directly, but I've seen them reported. I would say two things. I think, although Jason is obviously not here to speak for himself, but I think he was referring to the fact that we had no evidence that this was something being directed by NHS England, and that remains the case, although we're seeking assurances on that. But the other thing that has changed since then is that we have got a bit more information about some of the concerns that are being raised. I think I referenced earlier on the discussion that the Health Secretary had with Scottish Care this morning. So we are still getting information on this, and for the reasons we set out, we take it seriously, but we hope that the issue can properly be resolved. On the issue of discussions with companies, National Services Scotland would deal with procurement and direct discussions with companies for us, and we continue to obviously talk to them about any concerns they have about companies diverting supply. As I said in my opening remarks, we do not believe at this stage, although we continue to monitor it, this is something affecting supplies into our NSS national stockpile. It appears to be affecting supplies direct to care homes, but of course we are being very vigilant about this because we want to address it as quickly as possible if there are issues to be addressed. Vivian Aitken from The Record.
Good afternoon. My question to the Health Secretary. 2 days ago you announced an immediate living wage rise for care workers. That rise has been referred to me this morning by unions as the most cynical spin of this entire crisis, because it is not new money. This living wage rise had been agreed some time ago, and the care workers to whom it applies already knew they were getting it. However, it does not cover local government care workers, nor, I understand, home care workers. Therefore, Cabinet Secretary, what are you going to do to reward the tremendous efforts of these groups of workers?
Again, this is an issue that the Health Secretary covered in detail yesterday, but I know we'll be happy to do again. Jean?
I am, in fact, talking to Unison later on today, so if they have particular concerns, and very happy to talk to Unite and others on this as well. In fact, I had a telephone call with all of those unions and with COSLA just last week, and none of those concerns were raised with me at that point. But again, I'm always happy to discuss concerns. This is new money. This is a new agreement which the Scottish Government is funding. And the two important parts of that are that rather than go through a period of protracted negotiations, which means that the workers who deserve that increase and need that increase are waiting some time to find out what it might be, we have agreed that it will be announced now and will be paid from the 1st of April, so people aren't having to wait to see what is happening. So that's the additional part that is new. And the second part is our commitment to fund and ensure that funding is available to support those workers who are absent from work because of COVID-19 or because they are either shielding or they're part of a household that is in isolation. And the other point that I would make is that it does cover care workers, home care workers, personal assistants. Those are the important individuals who provide direct care to an individual, and the individual is the employer of that personal assistant. So I think it covers a broad spectrum of social care workers and is a small indication. We never claimed it was more than that, but it is a small indication of the degree to which we value their work and their contribution.
Libby Brooks from The Guardian.
Hello, First Minister. Can I ask about prisoners, please? Just given that the moves on emergency release appear to have been delayed, I was wondering if the Scottish Government is going to give out more detailed information on infections within prisons, for example, number of positive tests, how many are going to hospital, how many are requiring shielding in prison, that sort of thing.
I'm very happy to see what information we can give across a range of these issues, because again, in prisons, as in any other setting, we want to be as open and transparent on that as possible. We continue to look very carefully at the overall numbers in our prisons right now, and obviously the impact that combined with staff absences will be having on as is the case just now in prisons, restricted regimes for prisoners, which obviously has an impact on their health and well-being. I think I mentioned a moment ago, Scottish Cabinet has met this morning. That was one of the issues we were discussing, that the prison population has fallen over the past couple of weeks, but we are on an ongoing basis looking to see whether there is a need to use some of the new powers to potentially release some others that are getting to the end of their sentences. We've always said that would be a last resort, but we've never ruled it out, because we need to make sure that the conditions in our prisons are appropriate for the care and of those in our prisons, and also for the staff who work there. So as we take, if and as we take further decisions in that, obviously we will set out these decisions clearly. Paul Mallock from the Courier.
Good afternoon. My question is on mental health. In NHS Tayside, we've been told that psychology-led appointments in mental health services have been paused while the coronavirus outbreak continues. What impact and how do you estimate the waiting lists are going to be for psychology services if this disruption carries on for 3 months? And more generally, we know that NHS Tayside was subject to a review by Dr. Strang earlier this year, in which he said there were long-standing challenges with mental health services in Tayside. Do you expect NHS Tayside to continue implementing the recommendations of Dr. Strang's report, in which he called for a fundamental redesign? And how are you going to mitigate the impact of this outbreak from stopping mental health services improving in Tayside and across Scotland?
I'll ask John to comment to the extent that he wants to on that, and then the Health Secretary may want to add something on the Strang review and implications around that. John.
Thank you, First Minister. We're in very regular conversation with all the health boards, as I said earlier, and I had a telephone meeting with Kate Bell and with their medical director just this week, and we were reviewing how they are managing the transformation of services that they're having to do. And as I said, services all across Scotland are having to change how they prioritise cases and manage caseloads, and we are actively supporting that, not just in terms of advice and encouraging collaboration between boards, but also specifically in terms of Tayside in assisting them with additional staff help and leadership. The psychologists do provide a very important service, the psychological responses, and those are continuing, but there has to be priority given, and we have to allow services to be able to do that and make decisions based on clinical need.
As I'm sure you recall, when we outlined our hospital mobilisation plans, our board mobilisation plans, we said that there was some business as usual that absolutely had to continue. That was urgent care, accident and emergency, cancer care and maternity. But we also had some specific conversations with individual boards about other areas of their work that we did not want them to pause or put to one side as they address the particular challenge of COVID-19. And in Tayside's case, that work was the implementation of the Strang reviews. So that work continues. There may be some impact too, of course, because of staff absence as a result of COVID-19. We know that absence rates are running at about 4.6% for our staff at the moment. So there may be some slowing of the pace that we would want to see in implementing the Strang recommendations, but there is absolutely no pause on implementing those recommendations in Tayside.
Thank you. Chris Musson from The Sun.
Hi, First Minister. In response to Ross Govens, you said you were examining different options for ending lockdown. Can you explain to the public in simple terms what some of these options are? And if you won't, can you tell us why you won't, given your pledge to be as transparent as possible?
Well, I'm happy to do that, but I want, before I do it, both for the media and also for the public watching, to say, please don't take this as fixed decisions, because some of the options, when I talk about them, will be obvious, but we are not yet at a position to say we've got enough evidence to say we will do X, Y or Z. So there are a number of measures in place right now that ultimately concluded with the complete lockdown that we're all living with just now. So we had household isolation of symptomatic people or symptomatic people in a household. We've had school closures. We've had social distancing for people outside 2 metres apart. And of course, we've now got the stay-at-home measures. We've got certain groups of businesses closed. We've got other businesses being advised to close on a precautionary principle. So the options are there any elements of that it would be safe to start to release even before you released all of these measures? For example, could you see schools go back earlier than the measures generally being lifted? Could you see some businesses going back, some shops reopening? And you start to see from other countries, these are the kind of things that are being thought about there as well. So we need to be very careful and considered about how we judge the impact that these things would have. Would some of these things just lead too quickly and too dramatically to an increase in the virus again? So there's no desire not to be open about the kind of options that obviously are under consideration, because it's lifting the restrictions that are in place. But I am not going to stand here before I'm able to be categoric about what ones we would lift, when and in what order. I'm not going to do that until I feel confident, based on the best advice I've got, that it is the right action to take. Rachel Watson from the Daily Mail.
Sorry. First Minister, last week you urged people not to take their loved ones and relatives out of care homes. You said that, and since then we've seen a lot more concerns raised around people contracting the virus in care homes, deaths in care homes, concerns about protective equipment for workers. Is that still your message, that you believe people are safer in care homes than they would, say, their families taking them out if they can? And do you believe care homes should still be taking in new residents if they have been affected by the outbreak?
Care homes, let me say a couple of things. We know, not just from our experience in Scotland, but from increasing evidence around the world, that care homes are particularly susceptible to outbreaks, and that I think in many countries we are starting to see that a significant number of people who die from coronavirus will be in a care home. And that is partly because older people are more at risk of becoming seriously unwell and dying. So what we are focused on doing, because this is an issue of huge concern and priority for us, what we are focused on doing is making sure, working with care home providers to make sure that the guidance that was issued at the outset of this epidemic is being followed. Some of that guidance is really hard because it applies isolation to older people in care homes as it does to the rest of the population, staying within their own rooms rather than in communal areas. We're working to make sure that there's good infection control in place in care homes and that all of the right steps are taken to protect older people in care homes and protect the staff that are working there. So that is work that is underway and will continue to be underway, largely for the Scottish Government through the Care Inspectorate, but on occasion directly with care home providers as well. And that will continue to be really important right throughout this epidemic. Kathleen Nutt from the National.
Hello, First Minister. I just want to ask you about the PPE issue again. Have you spoken or contacted any of the PPE companies to say that they can indeed supply safety equipment to Scottish care homes and Scottish care agencies?
I've not personally had those conversations. As I said a moment ago, discussions direct with suppliers would tend to take place on these issues with National Services Scotland, which is our national procurement agency for the National Health Service. And I don't think there's more I can say on this issue than I have already said. We're still trying to understand and find out the detail of some of the reports that have been made and some of the statements that have been made around this, and then we will take whatever action that we think is necessary and appropriate to try to resolve this, because we want to resolve it in the interests of proper PPE supplies in Scotland and in the interests of wider cooperation and collaboration. David Ball from the Herald.
Thank you, First Minister. Are there any concerns that social distancing measures are resulting in mental health support not being as appropriate as you'd like for some people? Or are you satisfied with measures like the computerised cognitive therapy giving people adequate support? And also, how widespread are you expecting people to be suffering with mental health issues during the pandemic?
I'll hand over to John to take that question.
This is a wonderful opportunity for us in Scotland to actually explore digital technology and use new technology in ways that we haven't before. The computerised cognitive behavioural therapy is actually extremely effective, and before coronavirus we were rolling it out to all health boards, and the numbers of people who were using it and were valuing it were steadily rising. So I have no concerns that isn't the right treatment for people. There are some individuals who actually prefer to be able to do a course of cognitive behavioural therapy really on a computer in the privacy and of their own home. And I should make it clear that the computerised cognitive behavioural therapy is not a watered down or version of face-to-face cognitive behavioural therapy. It's really what is the best option for a person, and how does that individually get matched.
And the last question I have today is from Kieran Andrews at the Times. Kieran, are you there?
Yeah, thanks very much. Do you believe that it is appropriate for health boards to instruct their staff who could work from home to come into offices which are not designed for social distancing?
I'm not hearing you, Kieran. I'm afraid your line is not clear.
Sorry. Do you believe it is appropriate for health boards to instruct staff who could work from home to come into offices that aren't set up for social distancing? And what effect do you believe that will have on their mental health, given the thrust of today's press conference?
So in general terms, I've got a feeling there might be a specific example that lies behind your question, in which case, if there is, I'd be happy to hear that and answer it specifically. In general terms, people who can work from home right now should be able to work from home, and that people who have to be in work because it's not possible to work at home and what they're doing is necessary, there should be appropriate social distancing in place. So I'm very clear that nobody should be getting expected to work in a way that breaches one or other of those principles. But as I say, I have a feeling there's probably a specific issue lying behind your question, and if you want to feed that into us, I'm happy to give you an answer that is more directed to the specific example. But that's the position in general terms. That concludes the questions for today. Can I thank all the journalists who've taken part, and can I thank everybody at home who has watched. I hope you have found the information on mental health services to be of assistance today. Can I thank Dr John Mitchell for joining us and helping to convey that information. We will, through these briefings, the main purpose of them is to provide updates on the spread of the virus and what we're doing in response to that. But we know that the impact of all of this has been felt in many different ways. So we will continue on occasion to try to address those wider impacts and provide as much help and assistance as possible. But for now, thank you very much for joining us, and we will see you again at the usual time of 12:30 tomorrow. Thank you very much.